our second coronavirus information webinar. We'll follow a format that's fairly similar to the format that we used last week, and we'll go through the agenda. We have three panelists today. Alysson Satterlund, our Vice Chancellor for Student Affairs, has joined Dr. Torriani. Dr. Torriani, as you will recall, is our Program Director for Infection Prevention, Hospital Epidemiology from the health system, and Dr. Stacie San Miguel, the Director of Medical Services, Student Health Services. So we're going to talk about coronavirus, how it's transmitted, the status of the outbreak at the moment, both what's happening in China and around the globe, the clinical picture, timing, prevention efforts that can be undertaken, as well as how the health system and student health are responding to this outbreak.
Hi everybody, my name is Francesca Torriani and I will be going through the next few slides. And as we said last week, this hasn't changed much. The coronavirus is part of a very large family of viruses, some causing diseases in humans and others circulating in mammals. This 2019 novel coronavirus, or 2019 nCoV, is a new respiratory virus that was first identified in Wuhan, China. Many of the patients in this outbreak had frequented a large animal market, seafood and animal market near the station, suggesting that this virus likely emerged from an animal source. Other coronavirus that emerged to infect people came from civet cats, and MERS came from camels. Some coronavirus are highly contagious. Some viruses are highly contagious, such as measles and chickenpox, and other viruses are less contagious. And so far, the novel 2019 coronavirus appears to spread similarly to influenza and other respiratory viruses. Person-to-person spread with MERS and SARS occurs mainly via the respiratory droplets that are produced when a person coughs or sneezes. And these infectious droplets are either inhaled or fall directly into the eyes or the mouth, or they get on the hands when the hands touch contaminated surfaces, and then they are spread if contaminated hands are not washed. The spread of coronavirus, MERS, and SARS between people has generally occurred in close household contacts. Let's do an update on the spread of the outbreak at this time. As I had showed you last week, basically this virus spread quickly from 291 cases on January 20th to 5,970 cases on January 29, and this seems right for us for following how many people are getting infected. We know that now 4,000 persons infected in China, and 11 in the United States, 4 in Canada, 12 in Germany, 13 in Australia, and 24 in Singapore, to name the most hit. This is a map of how many cases. As you can see, the most of the disease is 24,630 patients with this disease, 24,405 are from mainland China, and then from other countries and regions. We have a suggestion that cases in China are slowing just a little bit, and clearly we can't say that they're completely slowing, but as you can see from this curve, there's been a slowing in the past few days compared to the steep curve we had. And as we can see, there is a slow increase in cases elsewhere other than China. Clinical symptoms, we have a little bit more detail from papers that have been recently published, and more papers are coming out. But the reported illnesses for now have ranged from mild to severe symptoms of a respiratory disease, mainly pneumonia. And most common presentations in China have been, as I said, pneumonia, and symptoms include fever, cough, and shortness of breath. And symptoms appear 2 days after the exposure in general, and can last up to 14 days. Worldwide, as of the 2nd of February, I think the 4th of February, there were 494 deaths out of 24,630 confirmed cases, and therefore the rate is 2%. And as you may remember, this has decreased down from 2.2 to 2%. The death rate with SARS was 9.6%. The current influenza season has 6.7% of cases, with now more than 7,000 deaths in the US alone. This suggests that coronavirus is associated with an overall lower mortality than SARS and seasonal influenza at this time. There is currently no vaccine to prevent this novel coronavirus. However, I would say that there are some experimental antivirals that are being tested currently, and you may have heard that some companies are testing antivirals in China, currently in Wuhan, and some may be available under special FDA conditions to persons who are infected with this virus in the United States. I am showing here criteria, CDC criteria, and basically these have changed since last week, but I would want to concentrate on 2. Hubei province is the province that is most affected in China, and so to make a patient under investigation, you need fever and signs and symptoms of a lower respiratory illness, so fever and cough, and a history of travel from Hubei province, China, within 14 days of symptom onset. Now, I do want to, you may be aware that yesterday we received American persons evacuated from Wuhan, China, and so MCAS Miramar has received 136 adults and about 30 children. These will be quarantined for 14 days in single rooms. The threshold for these persons to be referred for a patient under investigation is extremely lower in an abundance of precautions, and so these are being sent to either UCSD Health or Rady's Children's Hospital, and are being ruled out at that time. We currently have 3 patients being ruled out at UCSD Health and 2 at Rady Children's Hospital. And here I will pass the microphone to Dr. Stacie San Miguel, who will update on the student health services.
And hi, this is Dr. Socia. I just want to remind our audience that we will be taking questions and answers, and that if you email us your question, any leader from Student Health, and I will be reviewing those.
San Diego Health, as well as with UC, the Office of the President, and other UC campus student health clinics, and the San Diego County Public Health Department. We've continued monitoring the situation, looking at the scientific information that's being provided by the World Health Organization and the Center for Disease Control. We're following the guidance of these international, national, state, and local public health departments during times of public health outbreaks. And our policies for UCSD faculty, staff, and students are based on recommendations by these public health organizations. So since our last webinar, the Office of the Chancellor has sent out 2 UC San Diego campus guidance for students, staff, and faculty who are planning to travel, recommendations for those who recently returned from China, and a list of resources to access medical or mental health issues related to the novel coronavirus. So please keep an eye out for these messages from the Chancellor, because they contain a lot of information. We are posting them on our website at Student Health. We have also been sending these notices to departments that work with parents, so that parents can also receive this information. So currently, UCSD Student Health is following the protocol listed here. Our standard practice is to mask all students they have a fever, and we've been doing this for years. However, we have been screening students for potential risk for exposure to the novel coronavirus infection. We would like students with symptoms to call, and the number is posted here, 858-534-3300, before arriving at Student Health for guidance, especially if they've had a history of travel to China recently within the last 14 days, or if they've been in contact with someone who's been diagnosed with a novel coronavirus infection. When the students come in, we've been screening for travel to China within the last 14 days and symptoms of fever, cough, difficulty breathing, and evaluating them for any contact that they might have been exposed to this virus. If the students have been identified to be at risk, we then place them in our isolation room, and the patients are evaluated by one of our physicians. We're looking for evidence of lower respiratory infection, and we test them for other causes of respiratory infection, including influenza. If we identify any students that meet the PUI definition, or patient under investigation definition by the CDC, or if we have any questions, we contact the UC San Diego Health infectionist preventionist for further directions. UC San Diego Health is committed to supporting our students.
Yes, we are.
We appreciate that help, Dr. Torriani. So at this time, no UCSD students seen at Student Health Services had met the CDC criteria for the patient under investigation. Again, we are providing masks for any students that are seen as a patient at Student Health with respiratory symptoms. We're suggesting that students that are ill, especially with fever, stay home and do not go to class. They can call Student Health Services at this number, to speak to an advice nurse at any time of day for guidance and recommendations on the next steps. And students can call this number regardless of if they have SHIP or not SHIP. We will take any calls from any student with any health insurance. We do have an after-hours advice nurse line for guidance. And again, if it's appropriate, the students will be sent to be seen at the UC San Miguel Health Emergency Room or Urgent Care. If your advice is, if the student is advised to stay at home, not to go to class, we have a no-no policy that's in effect, so you don't need a note from us if you've been advised when you call to stay at home. So we've been continuing our efforts on campus to make sure that we are ready for the students. We have been having this messaging about how to prevent infection, and one of the main things is good hand hygiene. We are working with campus departments to increase access to hand sanitizing stations around campus. We've also been working with other campus departments to identify housing for students who are seen at Student Health, who live on campus, and who would require isolation. This is going to be determined on a case-by-case basis under the recommendations of the San Diego County Public Health Department. So how can you protect yourself? Well, first of all, avoid traveling to high-risk areas. CDC now recommends that travelers avoid all non-essential travel to China. Hand hygiene. Wash your hands often with soap or water, or use the alcohol hand gel. You want to especially do this before eating meals or after going to the bathroom. We want to encourage respiratory hygiene, so avoid close contact with sick people. If you are sick, please limit your contact with others to keep them from getting infected. Cover your nose and mouth with a tissue when you cough or sneeze, and if after using it, throw the tissue away and wash your hands. If you don't have a tissue, please cough or sneeze in your sleeve, not in your hands, and avoid touching your eyes, nose, and mouth. Germs spread this way. Please also clean and disinfect surfaces and objects that may be contaminated with germs, especially if there are any shared areas like kitchen areas or the bathroom.
So before we go to our conclusions slide, I do want to bring up that last week, Janet Napolitano, our UCOP president, had the campuses develop policies around non-essential essential travel on California business, on University of California business. We have developed these policies. We have sent out an explanation of how this travel is going to be decided upon. But as you know, a lot of flights have been canceled, is only now permitted. Only American citizens are allowed to enter the country and are being quarantined for 14 days. So I just want to say something about that, because I realize that Dr.
I'm happy to add to that.
Yeah.
So for those of you that aren't here with us in the room, which is the majority of you, my name's Alysson Satterlund. I serve as Vice Chancellor, Student Affairs, and I want to reiterate that President Napolitano has directed that the UC community temporarily avoid all non-essential travel to China. And each UC campus and medical center has developed a process to determine if travel to China is essential or can be postponed. Now, our interim policy is consistent with this policy, but please note it's not a travel ban. UC San Diego faculty, staff, and students may have very legitimate reasons to travel to China for essential purposes and or personal emergencies. And each case is specific and unique, and you'll find information specific to the issues that you might be contending with as you consider travel at blink.ucsd.edu/safety/resources. And we'll make this information available as part of our webinar information. And we just want to reiterate that all travelers should practice health precautions, including, again, as you've heard earlier in our webinar, avoiding close contact with people who are visibly sick, practicing excellent hand hygiene, and covering coughs and sneezes.
Thank you, Alysson. And so in conclusion, I think what we want to say is that the novel coronavirus is an acute respiratory disease that is spreading rapidly through China and less rapidly through the rest of the world. The disease presentations may vary from minimal symptoms to severe pneumonia in about 20% of patients, and these are patients who presented at the beginning of this outbreak with very severe disease, so that number probably is lower. Death occurs in less than 2% of infected patients, and once again, these numbers will probably become much lower as we learn more about this infection. Human-to-human transmission, however, is occurring, but we believe that the evidence is that this is a droplet spread disease, meaning that you can be on a sea. So they kind of to not stay in the air and drop within 6 or 8 feet. There has been no documented transmission in planes, which is telling us actually that this is the same thing. There's very low attack rate of the death of an ophthalmologist in Wuhan, who was the first to describe, to alert the authorities to this outbreak, but also to remember healthcare workers there did not have the protection we had, and so were caring for patients without really knowing what this disease was and how the best way to protect healthcare workers and other people was, and we know that now. And in fact, when we look at transmission among people, we see that transmission is occurring in close household contacts, but that the whole family doesn't get sick. And so that is good news. And also what we've learned just recently, that actually that concern that asymptomatic individuals could spread disease to others is actually has now been refuted in the most high-ranging articles. And so we shouldn't be worried about that at this time. The best protection, again, is avoiding close contact with people who in areas that have high rates of infections. And as you know, since February 2nd, the Americans who are traveling from mainland China are the only ones to be accepted in the US and are under a federal quarantine of 14 days. Travelers who have arrived from China before February 2nd are being asked to self-monitor and to report any symptoms to the primary care provider, and then they will follow instructions from the primary care provider of eventual workup, avoid close contact, and wash your hands often with soap and water, or rub your hands with an alcohol hand gel, cover your sneezes, and get the flu vaccine.
So I wanted to also take this opportunity to just recommend, we're proud that UC San Diego is an international community of scholars, and we understand that many of you are worried not only about your own health and well-being, but also for that of your friends and family who may be living or traveling abroad. It's also understandable to feel uncertain or anxious during a public health crisis, and we need to remember to care for one another and to not make assumptions about others' perceived symptoms or any characteristics of identity. And this is a time for the UC San Diego community to continue to support one another. And I want to reiterate, your compassion and empathy for each other really makes a difference. And so on behalf of my colleagues here and across the university, we'd like to invite you to a student-centered, student-specific discussion next week, specifically a discussion for all students at UC San Diego around the coronavirus and how it might be affecting you, and a chance to come together and be in community. It will be Monday, February 10th from 5 to 6:30 p.m. In the Great Hall at iHouse, and we'll have again this specific information for this student-centered event available as well on our Blink site, which is hosting all the resources on these particular issues at UC San Diego.
Thank you. Dr. Torriani, a question. We have a sophisticated audience. They would like to know the influenza mortality you quoted. Does that reflect mortality from all influenza cases or the complicated pneumonia cases?
So these are the rates we get from CDC, and yes, that is correct. These are patients who in general die from complications from influenza pneumonia.
Right. So overall, the mortality for the routine case of influenza would not be quite that high.
Yes, overall, the mortality from influenza is really dependent on underlying conditions, and so varies in general, in the general population, between 0.1 and 2.5%. And clearly, if a person has underlying diseases and is immunosuppressed, that can be as high as 10%.
Thank you, Dr. Torriani. I think it's important for us to realize we have much more influenza in our community than we do. We have no coronavirus circulating in our community, but we do have influenza and the importance of vaccination as a protective measure. So thank you for that clarification. Another question, how long are the droplets infective if they've hit a surface? Days, weeks, months?
I would say that we don't precisely know, but the key is really, if you're around somebody who's sneezing a lot and coughing a lot, clearly those surfaces are going to have a high amount of virus for a certain amount of time. And so if in general, if you are sitting in a restaurant with somebody who is acutely sick, or sitting near a person who your plane companion is just, you're sitting near somebody sneezing and coughing, there's a good chance that you will get that if you're not immune, right? And so that is what we consider. So I would say it's probably it's between hours and days, but definitely not weeks and a couple of days. So that's why we say disinfect this. If you just wipe off the surfaces, you will avoid getting infected, and that's valid for the home too.
It sounds like a very important reminder for all of us who might acquire a cough, which would be hard to go through any winter season without at some point having a little cough here and there, to cover our coughs, make sure we have Kleenex, and wash our hands very carefully. So that preventive measure so we can take care of each other is so important. Another question, for someone who may have traveled from China and is perfectly well, they are not having a fever, they have no symptoms, is there anything they need to do differently at this time?
No, as we discussed, right, the evidence now is pointing to people needing to be symptomatic. So the time of incubation without symptoms is probably not there, meaning that you have to start sneezing and coughing. After all, this is the common cold virus, right? Coronavirus is there's four that cause this. And so the infection really occurs after basically exposure. So yes, so I would, and after being symptomatic. And so people who return from China should watch for symptoms and are not considered infected. But persons returning after February 2nd are going to be under the travel ban and so be quarantined because of the travel ban in place.
So for the individual, if I hear you correctly, Dr. Torriani, who may have traveled before the ban was in place, who are well, feeling fine, they do not need to alter their behaviors, but they should be on a little more alert, and at mild symptoms, speak to someone in healthcare, get advice sooner than we would someone who hasn't traveled to those areas. Similarly, a question that's kind of related, if you happen to come into contact with an individual who has traveled to China but is perfectly well, do you need to be worried?
No, I mean, I think at this time, I mean, there's no evidence. I mean, there's no evidence of asymptomatic spread. I think at this point, you just keep track of, you're not as likely to get the novel coronavirus if they're asymptomatic. So there shouldn't be any worry. If you have any questions and you start developing symptoms, and certainly contact your primary care provider. If you are a student, then certainly you can call Student Health for more guidance.
Right. So reiterating that individuals only become infectious when they are symptomatic, that well individuals are not transmitting the virus.
That's right.
Thanks very much. Can you speak to the after hours protocol in case a student calls on the weekends or at night? What does a student call Student Health? What happens?
So if they call that number after hours, we have an after hours nurse service that has been directed how to handle students who are calling. And if they meet the criteria that we've set forth and they have symptoms, fever, cough, shortness of breath, difficulty breathing or wheezing, then they'll be directed to go to the UC San Miguel Health emergency room or to the urgent care.
Okay, great. Thanks very much. Dr. Torriani has actually had to step away from the microphone. She is a very active working infection preventionist and is being consulted by many colleagues throughout the system. So I'm going to answer a couple questions for her. I can share that UC San Diego Health has received some individuals from Miramar. We don't discuss the patients, but just because they have been received does not mean they have the infections. They are being assessed. That is, so I don't want everyone to be a false impression that means these individuals are carrying coronavirus. That may not have been determined yet. And that was fairly recent that they arrived. And we're being very, very cautious. Similarly, precautions were taken as they transported these individuals both to Ray's hospitals and UC San Diego Health. It is possible that more individuals will be coming to the Miramar base and that other health systems will be taking care of these. All of our health systems who would accept a patient will be working with the public health department and will have assured that their staff are fully trained and have the proper equipment so that they are able to handle these patients safely. And I think it is important to realize that healthcare workers following the proper PPE, protective equipment, have remained safe, and that we also follow those same practices in student health. so that our staff and our healthcare workers were making a lot of effort to ensure that they are safe and well cared for. Question, I don't see this today, but masking has come up a number of times. I want to reiterate that wearing masks by the well has not been proven to be scientifically beneficial. But masks in the healthcare environment are extremely important, so that when some patients or students come into a healthcare environment with any respiratory symptoms, they will be given masks. And then if they are at risk, the personnel will also be using extra protective gear when they're evaluating them. Annie, do you want to comment at all from a nurse who's seeing and helping with these students, the precautions we're taking?
Yes, all of the students are that come in with respiratory symptoms are screened at the front desk and identified early. And I think that's really important to note. And as Dr. Stacie mentioned, that with any respiratory illnesses, the students are masked and if they're deemed to be at high risk, placed in a separate room with negative pressure, so that we're always on the lookout. The triage nurses will go into more detail, and they do wear a high level of protection if that's warranted, but only in those cases.
Okay, thanks very much, Annie. Another question is, why are we so worried about this virus? And I think, we know people die from infectious diseases around the world. Why the concern? It's because it's a new virus. We don't know its temperament, its behavior, its transmission. As every day goes by, more scientific information becomes available. The confidence now that we can say, if you don't have symptoms, you're not at risk of transmitting. We couldn't have said that to you last week. So similarly, the mortality, as Dr. Torriani pointed out, is very typical when these new viruses are uncovered in the world, that the most severe cases will come to light. And that's how we find out about it. So those that are mild, many of us have a cold, we don't go to the doctor. We won't find out about the mild cases. So with almost all of these outbreaks, the initial concern is of a more severe nature. It then settles down. Let's not minimize that, though, because we know SARS and MERS were quite serious infections. And we don't know in the very beginning, when the coronavirus was first being identified in January, how its behavior was going to play out, which is why this regular conversation, very active conversation, active websites around the world and in the infection prevention community with the CDC, staying on top of the latest information is so important, and why we make adjustments. So the concern is appropriate because we're learning. On the other hand, as we learn more, there is a lot of information that is reassuring. It is very likely that this virus will be around for a while. We will be seeing cases pop up around. We will know more in a few weeks and in a few months. We will continue to sponsor these webinars as long as there's interest in the community. We hope they are very helpful. Dr. Torriani has been able to return, as she has, I'm sure, guided another patient safely into the right spot of care. So we were just reviewing some of the precautions that we undertake to care for them, et cetera. Can you speak, Dr. Torriani, to the PPE when patients, healthcare providers are reviewing or assessing patients?
So we believe that this virus is spread through droplets and by touching surfaces. And so the two measures all providers do is we put a gown on and gloves. We put a special mask on called an N95 that filters out particles, and we put a screen that covers our eyes, or goggles, that that protects us from droplets that may fall into our mouth or eyes. And so that's how we protect ourselves when we are in contact with such a patient. The other thing that we do in the hospital setting is we create a pressure that is different in these rooms, so that what stays inside what is inside the room stays inside, right? We have this expression for Las Vegas, but basically we want everything to stay within that room. And so the air from outside is sucked in that room, and then the air is filtered out, and it's clean air outside.
Great, thank you. You mentioned that individuals with underlying medical conditions are more vulnerable. I think we just lost Dr. Torriani again. I think you may get the sense that Dr. Torriani every 15 minutes is being sought for her expertise. So the question was, are there demographic subgroups that are more vulnerable to this? And I would, if she comes back, hopefully she'll clarify, but to my understanding in reading this, this has not been reflected that this is a racial vulnerability or certain other characteristics. Underlying health conditions do make you vulnerable. If you're elderly, if you're immunocompromised, if you're pregnant, there are certain conditions that make respiratory infections harder to successfully survive, or you may struggle or need hospitalization with them, that if you are young and perfectly fine, you'd be able to manage at home with some good TLC, chicken soup, water, rest, and all those good things that our mom taught us all about. So I think the fact that this seems to have been, it just happened to have started in China. It's not that the Chinese population is particularly susceptible to the infection.
I think you're right, Dr. Sosha.
Thanks. It's good. Dr. San Miguel are backing me up on this one. Anyway, I think we haven't seen many more questions coming up. Annie, have you seen on your screen any new questions there? Please, we'll give you a couple minutes. If you have questions at the bottom of your screen, there's like a little Q&A. Feel free to type them in. I will also say that many of us have been receiving questions and comments from throughout the campus community, through the health system. We are trying to respond to those appropriately as best we can. But we want to use these vehicles as a way to communicate. Getting a response, we can't be overwhelmed. It is, there's, as you can see, Dr. Torriani couldn't even get through 15 minutes without being paged and called. So we are wanting to be very available to you. We're committed to having these webinars and other opportunities.
I think I'd also like to acknowledge towards that great point, Dr. Sosha, is the collaboration that's happening across UC San Diego Health and UC main campus, as well as our partners in environmental health and safety and the undergraduate residential communities and our graduate partners and our students and families and parents. And again, it's just been really fantastic to see the UC, the local government officials and community partners working together to care for everybody. So I wanted to acknowledge the work of all of y'all in this room and our International Student Programs Office, our International Student Business Office, and just the fantastic work that Dr. Sosha and Dr. San Miguel and Dr. Torriani have been doing, and all of our health practitioners and providers to ensure our students and staff and faculty's well-being. So thanks to all of you for that.
Well, thanks. And there is one more question that just came up is, are there treatments around to take care of individuals? I know there's a lot of support for the individuals who develop complications, but Dr. Torriani, we want to speak to treatment?
So specific antiviral treatments are investigational at this time. And there are a couple of antivirals that look promising. And as I said, some companies are already in clinical trials in China. And some of these medications will be available request to the FDA. And so these are experimental medications, but we will have them available if needed.
Great, thank you. And if the lay public wants good information, Is the CDC website the best source for up-to-date, accurate scientific information?
Yes, I think the CDC is an excellent source. WHO, I find also it gives maybe a more global idea, and I find it also an excellent source. There's plenty of information, but where I would recommend going to sources that are based in data and not sensationalism. And so CDC, WHO, the scientific journals have the best information. The other site that I think for people like me who like to look at data, there is an excellent site at Johns Hopkins that I showed in the slides, and that gives you an updated situation for all patients diagnosed with coronavirus.
All right, well, thank you. So I'd like to thank our panel, Vice Chancellor Satterlund, as well as Dr. San Miguel and Torriani for sharing their wisdom and insights. And we continue to want to be available to you as we go through this together. The campus is very safe, and we're all here to protect you.